My name is Marisol Meyer. I'm the Rural Health Project Officer for the Office of Primary Care and Rural Health at the New Jersey Department of Health. I would like to remind you a few housekeeping items before we start our next session. Attendees are muted but can raise their hand or type in the chat if there are any questions. To ask the speaker a question, use the Q&A window. Question will be addressed at the end of the presentation if time allows. To receive continuing education credits for this session, please complete the survey shared in the chat. Survey links will also be emailed to all attendees. When the session ends, attendees will be automatically routed back to the lobby to choose their next session. So we're going to move to our next presentation, and after this session, attendees will be able to provide an overview of the HRSA agency organizational structure, discuss organizational efforts across bureaus and offices to improve oral health, describe advances impacting access to oral health in rural areas of the country, and differentiate challenges and identify barriers for rural populations seeking dental care. So I would like to introduce Dr. Adam Barefoot, Chief Dental Officer, Health Resources and Services Administration, U.S. Department of Health and Human Services.
Thank you very much. I'm going to go ahead and start sharing my screen. All right. Are you able to see that okay?
Yes.
Okay, thank you. Well, I very much appreciate your time today. It's an honor to be invited to come speak on something near and dear to my heart. You know, oral health, everything oral health, but especially working in rural populations and trying to improve access to care. So I thought I would give you a little bit of a high-level overview today about HRSA efforts to improve oral health. And I'll go a little bit into my background, but as just somebody who was a clinical dental director in a rural FQHC in a prior life, I was aware of HRSA. I had heard the acronym and knew a little bit about it being an agency, but didn't have a lot of direct knowledge of all the work it does. And so I thought this would be a great opportunity to kind of share some of the work we're doing across our agencies and bureaus, so you have a better understanding and even maybe potentially some resources and opportunities available to you. So again, just some objectives. I'd like to just have a quick high-level overview of HRSA. I won't be able to go into detail. They're quite a short presentation, about 20 minutes, but I will try to provide links and resource information that you can follow up with. Want to try to describe some organizational efforts across those bureaus and offices. Talk a little bit about HRSA funding at the end. We're known kind of as a funding agency. We do a lot of funding comes through us, and how you can navigate the website, the tools that are related to that. And then again, just provide a list of resources that may be relevant to you and your organizations. So just very high level, just to kind of give a snapshot, this is basically an org chart of kind of the agency as it stands. What you will see is the big box in the middle is where the administrator, which is the head of our agency, sits, and her support staff. And then we have across the bottom what you would think of as a lot of the programmatic offices and bureaus, where a lot of the work around all kind of funding and programmatic efforts occur, but even those related to oral health. Then we do have some support offices such as legislation and communications. I will say there are something somewhere in the middle there that kind of work across agencies on the left side here, where you will see the Office of Special Health Initiatives as well as some other offices that tend to kind of work more in a cross-collaborative mechanism for some of those offices and bureaus you see across the bottom. And I'll kind of go into some of their work a little bit later, where some of the real rubber meets the road oral health work is being done. And so just going back, this Office of Special Health Initiatives, OSHI as we like to call it, is a fairly new office. It was established about a year ago in the fall of 2021. And my position as Chief Dental Officer had previously resided in a different office and bureau, and I'm honored to have my predecessor actually speaking after me, and so I hope to do her justice. And a lot of this is a credit to her, and she could probably do my portion of the presentation at least as well, if not better than me. But I'll try to provide as best I can a testament to her and her work with what we are doing today. And so, as I said, OSHI is a relatively new office. I sit in what's called the Office of the Director. As far as kind of programmatic focuses, we also have the Office of Pharmacy Affairs. The big agenda kind of in that section is the 340B program, which some of you may be familiar. We also have the Office of Global Health. But I kind of am an army of one in this office, along with sort of a counterpart in behavioral health, Patsy Cunningham, who we have similar roles in that we primarily function in a lot of cross-agency and intra-agency coordination and communication. HRSA, as you saw, is kind of segmented into different focus areas, and we'll touch on those. But sometimes that can create, natural communication barriers and challenges that, kind of create silos. And so one of my primary roles is kind of to break down those silos and really look at, what each bureau and office is doing in the realm of oral health and how it can build to kind of a broad overarching agency level strategic plan. How can we, use what we're doing as kind of an innovation roadmap for the future. I also do things like technical assistance and guidance on opportunities like funding opportunities. So if grants come through, a lot of times if they have oral health aspects, they may reach out to me and just see, checking for things like accuracy and subject matter expertise, but also just, where are areas of improvements, opportunities. Sometimes it may not even have direct oral health implications, but for instance, there was a NOFO around opioid training for healthcare providers. And I noted that they specifically listed out eligible provider types, such as nurses, PAs, nurse practitioners, physicians, but dentists, for instance, were not specifically listed. And so, recommendation is, a lot of dentists prescribe or have historically prescribed opioids related to dental surgery. And so that may be something to consider, considering they're a provider type that may could benefit from this. And so that's another area where I kind of come into play. I try to fill, gaps, look at data, look at where resources may be in one bureau or office that could be leveraged, and how can we coordinate that. I try to be the kind of the forward-facing agency lead for all things oral health for things like this, conferences, stakeholder opportunities, engagement, working with partners, trying to get feedback from these stakeholder groups about, what they're seeing, challenges, emerging trends. Try to be an ambassador for health centers. I can't claim to be able to get to around to every health center in the country, but when possible, I want there to be a face of somebody who's worked in a health center to know that there's at least someone out there that has an idea of what it's like on the ground, the challenges that you all are going through for those that are in the health center space, and understand and be able to communicate that back to my leadership. And then also just providing effective communication in the forms of strategic messaging, working with partners, literacy and awareness campaigns, and things of that nature, which I'll touch on a little bit later. So again, I spoke to my, kind of own journey. I actually, in a prior life, spent 6.5 years in a rural federally qualified health center in rural Georgia. This is actually a little picture on the left here of our little dental clinic. It was attached to a health department. So literally just those 4 windows you see was our little tiny dental office with an operatory. We had 3 chairs. I was in a town of about 800 residents, about an hour and a half south of Atlanta. In a federally qualified health center that was in a health provider shortage area, which I'll talk about a little bit more. I did the National Health Service Corps loan repayment program there, which again, I'll talk about a little bit more. But I have a great appreciation and consider that time there invaluable to know, what it was like working with underserved populations, disparate populations, working on a shoestring budget with limited resources, and have such appreciation for all those working in health centers have to deal with to service the communities they support. Then I actually got a master's in public health while I was there, and transitioned to state dental director for the Georgia Department of Public Health. So tried to adopt some of those public health training strategies and approaches that I learned in my MPH program to population and community-based approaches, working as a state dental director. I was also got to be the beneficiary of working on the receiving end of a lot of HRSA funding through things like Title V and some pilot programs that I'll speak to in a little bit. And so again, a lot of appreciation for HRSA, what HRSA does, kind of empowering state and local programs. And then eventually led me to my current position when I joined as Chief Dental Officer in May of 2022. So we've been talking a little bit about health centers, and that's a big focus of what HRSA does. Our Bureau of Primary Health Care helps directly fund FQHCs and lookalikes via 330 federal grants, which many of you may be familiar with. HRSA funds nearly 1,400 health centers and approximately 100 lookalike organizations, which comprise more than 14,000 service delivery sites across those networks in communities across the country. And in 2021, health centers achieved a historic milestone, serving more than 30 million people. I have such appreciation for this, and I know this is just a kind of a statistic, but understand, what we were going through in 2021 and 2020. What is written on a slide sometimes doesn't really encompass the totality of what we have just seen. I just have such admiration and respect for those underserved safety nets that met an unprecedented challenge with what we saw with the pandemic. Even if you weren't facing it in direct response, a COVID response, even if you were, in other areas like dental or primary care, just trying to get by and really going to work in what is beyond an uphill battle on a shoestring budget and limited resources, to be that safety net, to try to support the people that need it most in really an unprecedented time. And so again, for all of you out there that are working in safety nets, whether FQHCs or other types of charitable clinics or working with underserved populations, just the most respect possible for you all and what you do on a day-to-day basis. And a lot of these people, this is a rural oral health conference, as noted, and so I should be remiss not to note that 1 in 3 people living in poverty and 1 in 5 rural residents are the types of populations that are served by these health centers. The health center program provides a range of services, but including oral health for underserved populations. Most of the grantees either provide dental services directly or do a referral system. In 2021, close to 6 million patients receive dental services in health centers across the country, including about 56% of children patients age 6 to 9 receiving care, and health centers receive dental sealants, which is one of the strongest evidence-based interventions to reduce dental decay. The Bureau of Primary Healthcare also funds certain one-time opportunities, like a 2019 infrastructure oral health funding supplement, which allowed building out an expansion of physical facilities and things like dental clinic expansion, integration of oral health into other kind of medical primary care services. The Bureau of Primary Healthcare also funds things like PCAs, your state PCA office. If you're not familiar with it, Primary Care Association is a wonderful asset if you are in the health center space, of which they provide resources, technical assistance, and everything from operations and guidance around patients and funding sources and things of that nature. They also do things like award grantees like the National Network of Oral Health Access, which provides technical support and resources, and they share best practices for oral health programs within health centers. And then they also help establish things called the Uniform Data System, or UDS measures. These are here to help track health indicators across a range of health topics. One being oral health, and the one UDS measure we have in the oral health space is a sealant measure. NOAA, the National Network for Oral Health Access, is one of our groups that are helping health centers start tracking that information and really get an uptick on those collecting that information. It really helps establish baselines, area of needs, area of improvement, because without data, we don't really know, where the area of focuses need to be. Another area of support is oral health workforce. We have a very big challenge in the healthcare workforce space in general. The pandemic, it seemed to make it far worse. However, we had trends showing some deficiencies in health provider workforce even before that. HRSA projects about a 4,800 dentist shortfall by 2030. So the Bureau of Health Workforce is working to identify areas of need for things like HRSAs, helping provide training to providers, and so we can ensure a competent and educated workforce moving forward, and things like supporting state oral health programs to build workforce capacity within their respective states. I mentioned helping identify areas of need, so we don't know, where resources need to be allocated without knowing where there are the deficiencies. And so I won't go into all of these, but needless to say, we have fancy equations with lots of variables to identify different shortage areas. And you can see some of the types here. Some are more general, some are specific, like maternal care. I don't have time to kind of dive into these, but these are links if you want to go learn about a little bit more. But that is a critical focus area. We don't have a national dental provider repository in terms of knowing where providers are at or located. We know that there is on the aggregate, maybe enough dentists and hygienists to serve the population, but the distribution of those dentists and hygienists are not necessarily distributed in a manner that meets the access to care needs of the populations they serve, especially in areas like rural areas. There are some cross-cutting things that are factor into, generally speaking, all those type of shortage provider areas. Things like population to provider ratio, looking at census data, looking at geographic distances. But basically, it comes down to a lot of where are their people, where are their providers that are willing to see those patients, and what are the gaps between there, whether the geographic gaps or socioeconomic gaps, and how do we incorporate that into maps to know how to allocate resources efficiently to incentivize care in these areas. Another area when in terms of workforce is, okay, so now we have addressed finding those access to care challenges. What can we do to empower them, to empower that workforce? So the Bureau of Health Workforce works through the Public Health Service Act and the Title VII of that act. There are multiple, as you see, 5 bulleted points there. Those are all basically funding sources geared towards training programs for pre-doctoral and postdoctoral training, typically in either general or pediatric or public health dentistry. We have things like faculty loan repayment programs. Sometimes it's hard to recruit staff at our education training centers. They're competing on things like, challenging the salary to the private sector as well. And so we want to ensure we have those educators and those facilities to ensure the next generation of those oral health providers are getting quality education and coming out into the world to help provide those services. Another area of focus I mentioned earlier, state oral health programs. And so in a different section, the Title III of the same Public Health Service Act, we have grants that support state oral health programs. I think the last count I saw through this T12 grant was about 32 state oral health programs received this. I was fortunate enough in a former life as a state dental director to work with our dental school in Augusta, for instance. We were a state that endorsed our grant over to the dental school and worked with them in partnership. And they did things like use the funds to have students do externship rotations in underserved areas, oftentimes rural areas. They sometimes would partner through FQHCs. They would sometimes partner through charitable clinics or local health departments that had oral health programs. And so what this does is it provides extra work capacity in those areas of need that are oftentimes working with very limited resources. It provides an opportunity for the students to receive quality clinical real world experience, obviously under the guidance of a supervising dental faculty there or contracted dental staff there. But also hopefully exposes them to working in this population and maybe actually encourages them to come after their education and training and actually set up shop or work at one of these healthcare centers, working in the public health sphere, having gotten that exposure. Additionally, in this sector, we have the National Health Service Corps. The National Health Service Corps works by supporting qualified healthcare providers dedicated to working areas, basically those health provider shortage areas. In 2021, we had about 700 dental clinicians supported through the National Health Service Corps. I was actually a beneficiary myself. And my own little caveat side story is I did this for 3 years, I believe, and paid back my loans. But even after that, I stayed on for another 3.5 years. It's real testament to the program. Even after the financial incentive was removed, I had kind of found a passion for working in that area and working with those populations to try to really make a real difference. And I think that is one of the best things. It's not just a recruiting tool to bring people to those areas, but hopefully, again, it gets people exposed to that. And for those that really are passionate about it, keeps them there longer even than their commitments require. In 2023, we project about $413 million dedicated to these programs. It's always different a little bit each year, depending on what the congressional appropriations are for it. But we're seeing right now about 19,000 providers with 8,200 awards expected in the next year. And it is important, if you are a kind of safety net site, you can apply to become a National Health Service Corps site. And then you can kind of advertise to potential recruiter or staff that may be providers you're trying to recruit, that you're an eligible site. Any providers have to apply independently once the site is approved. And again, there are a lot of factors involved. There's a scoring system depending on things like HRSA scores and other things. But it's a wonderful tool to try to kind of fight some of those uphill battles to get people in those areas where there really aren't enough providers. Again, looking at other populations, the Ryan White HIV/AIDS program provides support for a lot of different healthcare aspects, one of which is dental. There's a bunch of different programs in the Ryan White, A, B, C, and D, and then Part F. It's a little confusing because there's no E. But Part F has something specifically called dental, the dental programs. That's more geared to dental education for things like dental schools, residency programs, and even community colleges with dental hygiene programs. But it's important to note that all parts can be used for oral health services. So I encourage you to kind of go through those. I don't have time to go through each one individually today. Maternal and child health is another area of focus for a subpopulation. There's something called the Title V block program, block grants that go out to states across the country to support mothers and children, basically, and other groups like special healthcare needs individuals. They support a range of services, one of which is oral health. We have national performance measures, and our NPM 13 supports oral health preventative dental visits for pregnant women, and then also it's broken down by children. This is a map. The blue areas are states that support at least one of these two national performance measures. So if you happen to be in those states, I encourage you to reach out to your state Department of Public Health Title V program and see maybe there's an opportunity for partnership. They also support grantees such as the Centers for Oral Health, for the National Maternal and Child Oral Health Resource Center, which works on a lot of things like medical dental integration, looking at quality metrics for MCH populations. Again, I don't have time to read through all of this, but I have their sites linked to the end. The MCH, Maternal and Child Health Bureau, also looks at things like data for opportunities like the National Survey of Children's Health is funded through HRSA. Their funding can also be used to things like PRAMS, the Pregnancy Risk Assessment Monitoring System, to understand some of our baseline trends around oral health, as well as a number of other indicators. And even establishing, as I said, oral health indicators for MCH populations, because we don't really have a good standardized set of those, especially in terms of oral health right now. A last kind of area of focus is areas of oral health literacy. In OSHE, we are funded to do a oral health awareness campaign, which we hope to roll out by the end of this year. A credit to a lot of work from my predecessor who had done with that. And we have potential for expansion of the campaign in the future. And of course, many of our other areas of focus, our offices and bureaus do things indirectly for oral health awareness and literacy. Things like that I've already discussed with the HIV/AIDS Bureau and Ryan White, the National Maternal and Child Oral Health Resource Center, and the National Network of Oral Health Access. Lastly, I'll mention the Federal Office of Oral Health Policy. I encourage you to search their website. They do have a rural oral health toolkit. They support a lot of things broadly in rural health in general. As you can see, they had $12.7 million go out to 61 grantees in 2021, 7 of which focused on oral health care delivery. And they have a lot of resources on their page, a broad range of services, but including oral health. So that brings me to funding. I would encourage anybody to visit our site and look, just click the Find Funding button. There's basically a search tool where you can type in different, if you know the grant number, but also if you know general speaking, parts of the words in the title of the grant. You can also search by state. And then you could find an individual grant and view the details. I encourage you to look, even if you don't have knowledge of funding, just see who's being funded in your state, what organizations. There's a lot of times opportunities for partnership you may not be aware of. And so again, I would encourage you to find those that are receiving funding, especially if it is oral health related. And that's something you're interested in. They may be somebody like, the T12 grant I mentioned with our dental school that was looking for places for residents to go work on externships, but it could be a whole host of other opportunities for partnerships. So just having that knowledge, reaching out, contacting them, seeing how you can partner, I think is a wonderful way to leverage those opportunities. Finally, we have a public-facing data site where you can look at things like health workforce. We have a number of different graphs and mapping tools. I could spend a whole presentation on it, so I won't right now, but feel free to play around on this data.hrsa.gov website, because you can find things that can help affect policy in your local regions or states. You can find resources available. You can find things that can help show where areas of needs are. Again, this could be a whole presentation unto itself, so I will just leave that for today. And this is the same kind of page that shows the data and resource and different resources available. And so I will end. These links are a lot of the things I talked about today. I want to respect time, so I won't go through all of them, but feel free to kind of go through a lot of more